Hi, I'm Gina Ossanna, and I'm a speech language pathologist with the Hello Foundation. And I'm so glad you could join us today. Today I'm going to share 10 tips to keep in mind when working with English language learners. And I wanted to just give a little bit of background on my own professional experience working with English language learners. I've worked in the schools for about 13 years, and my experience has been mostly working in the urban and suburban settings. I worked for Portland Public Schools for 7 years, which has a diverse student population. I think more than 90 languages are spoken in the district. And currently I contract with Yakima School District, where 70% of the students are Hispanic. And right now I'm at a school where the majority of students are native Spanish speakers, and many students receive their academic instruction in Spanish for grades K through 2. So these students are also receiving their speech and language services in Spanish. I have a bilingual assistant who helps me, as I'm not totally fluent, but I'm learning. Today's presentation will focus mostly on language evaluations for English language learners. I'll also touch a little bit on articulation as well as some general guidelines for treatment. And I'd like to acknowledge Frank Bender, who shared with me much of the information that I'm going to share with you today. So as you can see, there are slides for you to view throughout the presentation on the right side of your screen, and above the slide is a previous and next button. So you can follow along as I go through the slides, and I'll try to remember to let you know when to advance to the next slide. So let's go ahead and start, and you can go to the next slide right now. So English language learners and our roles as speech language pathologists. According to the recent U.S. Census, 1 in 7 people speak a language other than English in the home. And our population of English language learners is growing. So as speech paths, we need to ensure we're utilizing the appropriate tools when testing and treating these students for a language disorder. It's really important, but it's difficult to differentiate a language difference versus a language disorder. And I hope these 10 tips will help you in your practice. So tip number 1, this is kind of a basic one. It takes time to learn and master English skills. Many people don't realize that typical English language learners, these are kids that do not have a language disorder, take 5 to 7 years to demonstrate proficiency in English and perform most language-based academic skills. So we really can't expect English language learners to have the same skills as native English speakers. And it's important to take that into account when we're planning our evaluation and our treatment. Tip number 2, when using standardized tests in English and in Spanish, if you're evaluating students in Spanish, we have to proceed with caution because these tests are not normed on native English, or they're normed on native English speakers. They're not normed on English language learners. And standard scores can be deflated by 10 to 15 points. So that means you could have a student who scores a 70 or 75 on a test, and they actually could have typical skills. So if a student scores in the average range on these tests, great. If not, more information is needed. We don't know for sure if they do have a disability. And one thing to think about is that, I speak Spanish, but I'm not fluent. And if I were to take the CEL 4 in Spanish, or even the PLS, the preschool language scale in Spanish, my scores would probably come out 2 standard deviations below. But I don't have a language disorder. I'm a Spanish language learner. So that's kind of another way to think of it. It's definitely more work when we're looking at, whether or not to qualify these kids. But one thing that I found is it really sharpened my skills as a clinician with all students. Okay, so tip number 3, instead of relying on standardized tests in English, I always ask myself this question: how does this student look compared to students of similar background? And by similar background, I mean, what are the students' educational experiences? What is their cultural background? And what is their language exposure? And I want to compare them to other students that have the same background as that. Specifically, I want to find out how many years the student has received formal instruction in English in the U.S. We'll expect different skills in English from an English language learner who's been here for 7 years versus a student who's been here for only 2. For example, I worked at a middle school a few years ago, and we had many referrals for students who were suspected of having language delays. And some of these students had arrived in the U.S. within the last year or 2, and some had been here since kindergarten. So I really had to look at these students differently when trying to determine if they had a disorder or if they were simply learning the language. And of course, the shorter amount of time that a student has been here can often make it a little bit more difficult, especially if we're unable to test the student in their native language. Another thing that can be really helpful is to talk to your English as a second language teacher. Some districts call it ELD, English Language Development. And in some districts, the teacher themselves is the English language instruction provider. And, they can really share tools with you that they use to assess English language development in your district. And they're familiar with what a typical English language learner looks like. And they can often tell you if a student is on track with their development of language skills in English, or if they're not developing at the same rate as their peers. Okay. And tip number 4 is to look at how this student has developed language skills in English over time. English language learners are given tests each year to determine how much progress they've made with their acquisition of language skills in English. And here in Oregon, our test is called the ELPA, which stands for the English Language Proficiency Assessment. Each state has their own version of this test. Washington has a test called the WLPT. I think that stands for Washington Language Proficiency Test. This test will assign a level of English language competency, usually on a scale of 1 to 5, with 1 meaning that they're non-English speaking or, kind of newcomer, and 5 meaning they're fluent. These levels are comparable to CELP levels, which you may have heard before, and CELP stands for Cognitive Academic Language Proficiency, and it gives information about a student's development of higher level language skills. I always look to see if a student is progressing at the same rate of as his peers. Most students will move up 1 level each year and are fluent English speakers after 5 to 7 years of instruction. A red flag for me is students who do not progress levels after years of instruction. For example, I had an 8th grader a couple years ago who was Cuban and had been in the U.S. since 1st grade, had been receiving all English instruction, and so 7 years of English instruction, and she received a level 1 on the ELPA. So that's a huge red flag. She's not progressing, she's not developing her language skills in English at the same rate as other kids that have been here since 1st grade. And of course, each state has its own standards and its own tests. So check with your local district to see what their scores mean and how to interpret it. Another area or another test that can be really helpful is the Woodcock-Munoz Language Survey. And that looks at the acquisition of language skills in English over time. It is also available in Spanish. So, and it gives standard scores. This test is related to the Woodcock-Johnson. It has an oral language score and it has 4 subtests. The following directions, verbal analogies, story retell, and I am forgetting the last one, but there's 4 subtests on it. And it'll assign a level of how the student is progressing with their acquisition of language skills, which is their CELP. For Spanish-speaking people, or for Spanish-speaking students, it can also be helpful in determining language dominance, what language the student speaks better, and that can also give you some good information on where to go with your testing, what language you should test the student in. Proceeding, I'm sorry, I've been forgetting to tell you to go to the next slide. So we're on slide number 11, and it says number 5 on the top, response to intervention. So response to intervention is something that is really becoming more popular. It's gaining a lot more support in the general ed setting in schools, and it looks at how students respond to different levels of intervention over time. A lot of the research out there is for learning disabilities. Sorry, I have a typo there on disabilities, but it can be applied to language disorders in the same way. It's a 3-tier model, and many students use this model to implement interventions before a student is referred for special education testing. And I always take this information into account when conducting my evaluations. Also, going on to the next slide, dynamic assessment. And dynamic assessment can be a really powerful tool when evaluating our non-native English speakers. It's a teach, test, retest model to determine if a student can learn a skill. And it's most important to determine if a student can learn, retain, and transfer a skill over time. And if not, this is a red flag. And dynamic assessment is kind of, you could do a whole presentation on dynamic assessment. So this is just a really brief description of it. But it can be a really valid tool when we're not so sure if those standard scores are giving us the information that we need. And I always include that information in my report. Tip number 6. So students with a language disorder will present as disabled in both languages. And I always try to find out as much as I can about the student's skills in their native language. That's easier when the students speak Spanish and we have a lot of tools and maybe more staff members that speak the language. It can be harder when, for example, in Portland we have a Tongan population, which is an island in Micronesia. And that can be more difficult to find, somebody that is familiar with that language. So these are just some general guidelines. But you can get some information from the parent by doing a developmental history. And I have a form that I use, and I always ask, kind of basic information. Were there any complications at birth? When did they say their first word? When did they start using sentences? Are they able to tell you about their day when they get home? Are they able to follow directions? To kind of some basic language skills to find out how they're doing in their native language. Does their grammar seem to be, confusing? Are they able to make complete sentences? There's also criterion-based tests that look at how a student responds and if they have a slow response time, if the responses seem labored, or any other indication of communication difficulties. Also, I always try to get a language sample in L1 or the native language, and beforehand I'll request an interpreter. And tell the interpreter what you're looking for. I'm looking for the student to tell a story. And does their story have a beginning, a middle, and an end? And is their information easy to understand? Is it clear? Do they have any grammatical errors or speech errors that seem unusual? So you could create a checklist that you would go through with the interpreter beforehand and then go over with them afterwards, so you could get information about the native language. If the student is Spanish speaking, the Woodcock-Munoz, which we discussed, can be really helpful. The Self-4 in the Spanish edition. And then there are bilingual editions of the receptive and expressive one-word picture vocabulary tests. Where this gets a little confusing is that these scores aren't always valid, because if the student has been in the United States and receiving all their instruction in English, we really aren't going to expect them to have fully developed language skills in their L1. Maybe their L1, their native language, is more everyday language and everyday conversation, but they're really getting more of that rich vocabulary in their second language. So their scores might actually be a little bit lower than their actual skill level on those tests as well. So, it's just really important to look at the big picture. And of course, if a student scores low in English, but in the average range in their native language, it's not a disorder. They're learning. They're English language learners, and that's typical to have errors in your second language. Okay, tip number 7, a student with a language disorder will look disordered no matter what the language. So, we're looking for just kind of basic things in both languages: deficits in vocabulary, communication difficulties at home, slower development than siblings. Maybe the student really needs a high-level assistance to make progress. They need a lot of redundancy and repetition to assist with their learning. And finally, that difficulty learning, retaining, and transferring information. And that last one is something that we can really gain more information by doing dynamic assessment. Number 8, some general guidelines on treatment, to keep it simple. I think we do a lot of this already as speech-language pathologists, but it's especially important for our English language learners. So to use short, simple sentences, provide models and visuals when learning new vocabulary, use scaffolding when teaching new concepts, and using semantic maps and graphic organizers to help with written assignments. And finally, I think this is so important, especially in the upper grades, and when kids get into middle and high school, teaching those strategies to students that they can use when they get stuck in class, like asking a peer for help, or checking in with a teacher, or trying think alouds where you're thinking out loud about what you're going to do next. Just a lot of those self-advocacy strategies can be so important for all our kids. And number 9, a note on syntax. Syntactic or grammatical errors are typical in all English language learners until 5 to 7 years of formal instruction in English. And I always hesitate to put any English grammar goals on an English language learner's IEP unless I really have a lot of evidence that they're having difficulty with that in their native language as well. And just some examples: African American English, that's not another language, it's its own dialect, but it's very common for African American speakers of the African American English dialect to omit past tense markers and to omit plural markers. And that's not a sign of a disorder. That is just a rule of the dialect. And also looking at other languages, Vietnamese, for example, doesn't use plural forms in the same way that we do. So many native Vietnamese speakers will omit a plural marker at the end of their words. And that isn't indicative of a disorder. They're just learning English, and that's a very typical rule that they're following that comes from their native language. And like I said, I speak Spanish, but I have many errors when I speak, and I would probably be diagnosed with a language disorder if I wasn't tested in my native language. So it's just important to keep all of this in mind when interpreting your evaluation results and when planning your treatment. Number 9, articulation. And it's really important to look at what's typical for the student's background, because student with an articulation disorder will present with the disorder in both languages. And there's so much information available online now that I had a student that was from Indonesia and spoke a language, an Indonesian language that was very, not very well known. And I did a Google search, and I was able to find the phonetic repertoire for the language. And this student wasn't using the TH sound or the R sound. And in looking at the phonetic repertoire, I found that those sounds aren't present in the student's native language. So, it made sense that he wasn't really using them in English. I also have to, and I have to think about, are the articulation errors due to the presence of a disorder, or are they due to an English language learner issue? So if it's the latter, they're not eligible for speech services. They don't have a speech disorder. Another example is R and V are pronounced differently in Spanish. An R in Spanish is almost more of like an English D, like in the word perro. It's more of an alveolar frontal sound, where the English R is in the back. V is pronounced more of like a bilabial fricative, yo me voy, so it has a little bit more closure. They're not using the labiodental the same way that we do. Doesn't mean they have a disorder. They're just speaking it the way that is consistent with their native language. On the same note, being a Spanish language learner, I'm still learning how to trill my R's. It's really effortful for me to do it, and many times I will forget. And I know for Spanish speakers, that's something that we wouldn't necessarily hear as English speakers, but when Spanish speakers hear me speak, they really can hear when I'm not trilling my R, because that's not typical in their language. I don't have an articulation disorder. I'm just learning how to use their phonemes the way that native Spanish speakers do. Okay, going on to the next slide. So I am on bonus tip, a little bonus tip for you. And I think we all kind of know this already, that parent support is really important. And this is especially important when instruction is not given in the student's native language. I'm lucky enough that I work in a school now where the kids are getting instruction in Spanish and they're getting their speech therapy in Spanish. I don't think, I know that that's not what's happening across the country, and we have so many children that speak other languages besides Spanish that maybe isn't spoken by anybody else in the whole school. So the parents can be such a great support for helping the students to develop their native language. Research has shown that strengthening a child's language skills in the native language will strengthen their skills in the second language as well. So, and I think there's a lot more support for this than there used to be. But whenever I am meeting with a parent, I'll say, I just think it's so wonderful that your child is growing up able to speak 2 languages, and I think it's so important they keep their native language, and there's a lot of things you can do to support that at home, like reading books with them and playing games and asking them a lot of questions, anything that will help the child's communication skills to grow. So to summarize, remember, it's important to determine if students have a language difference or a language disorder. We really have to be careful about over-identifying English language learners, and we don't want to label anybody as being delayed when really they are just truly new to our country and just learning our language. So as speech pathologists, we have such a privilege that we're able to really look at this and through a critical eye and identify the kids that really need our help the most. The second point is to look at how English language learners have developed their English language skills over time instead of comparing them to native English speakers. Of course, we talked a lot about that. And a student with a language disorder will present with the disorder in both languages. So do everything you can to obtain information on language skills in both languages. And then finally, keep in mind the same strategies you would use for a native English speaker when treating English language learners, such as scaffolding and use of visuals to support language development. I hope you found these 10 tips to be helpful when working with English language learners, and thank you for joining me today.